Welcome. In this video, we will talk about ulcerative colitis. And we'll talk about the definition, classification, epidemiology, and risk factors for ulcerative colitis. Ulcerative colitis is a chronic inflammation of the large intestine, colon, characterized by remitting and relapsing episodes of inflammation that causes diarrhea, belly pain, and bloody bowel movements. It's limited to the mucosal layer of the colon and almost invariably involves the rectum, and the extent often involves more proximal portions of the colon in a continuous fashion. This disease can be classified according to involved part of the large bowel or severity of the disease. There are 4 types of involvement: ulcerative proctitis, ulcerative proctosigmoiditis, left-sided colitis, and extensive colitis. Ulcerative proctitis, it involves the rectum only. Ulcerative proctosigmoiditis, it involves the rectum and sigmoid colon only. Left-sided colitis, it involves rectum, sigmoid and descending colon only. Extensive colitis, it involves rectum, sigmoid, descending colon, and extending proximal to the splenic flexure. Ulcerative colitis may be mild, moderate, or severe in terms of symptoms. Ulcerative colitis is more common in northern locations, age between 15 to 30 years and 1950 to 1980 years, male gender, Jewish population, and whites. We will now talk about the factors that increase the likelihood of developing ulcerative colitis. Increased dietary intake of total fat, animal fat, and polyunsaturated fatty acids has been correlated with an increased incidence of ulcerative colitis and its relapses. Sleep deprivation has been associated with an increased risk of incident ulcerative colitis and its flares. Several observational studies have suggested an association between acute gastroenteritis and the development of ulcerative colitis. Nonsteroidal anti-inflammatory drugs used for at least 15 days per month increase the risk of ulcerative colitis. Oral contraceptive use was associated with a higher risk of ulcerative colitis. Hormone replacement therapy was associated with an increased risk of ulcerative colitis. Isotretinoin, used in the treatment of acne vulgaris, his risk has been suggested by case reports. Stress may have a role in the exacerbation of symptoms in patients with established ulcerative colitis.